Hey everyone, welcome back to this live Q&A. This week we're discussing building the doctor-patient relationship. Last month we talked about the start of a doctor-patient relationship. Now we're talking about building it. And like any relationship, a doctor-patient relationship requires some level of work. Um, so I'm gonna go do a quick run through the things that we talked about over the past 3 weeks, and then I'll get to all the questions that you guys might have. But I just wanted to say thank you again for joining me this evening. I'm happy to have you here, and let's get into it. So, we started off by talking about the importance of combating misinformation. And right now, we're in a time where, because everything is on the internet, just like I'm here talking to you, everyone has a platform to give information. And unfortunately, it's not always correct information or the right information that you can trust. So I'm not telling you don't listen to this person or that person. What I'm saying is just make sure that the people that you're getting your information from are reputable sources, and that the information that they're providing you is credible information. So you want to make sure that you are trusting your doctor to treat you rather than taking the advice of a random person online. Okay. Um, Also, I mentioned about Dr. Google because a lot of us go to Google the first symptom you have, you Google it, and then there's a list of things that are really harmful or really bad, and it sends you into a panic. Let's just avoid doing that. Have a conversation with your doctor about the things that are going on with you. And one of the other things that I didn't touch on before that I did want to bring up is the fact that when we watch TV shows, a lot of times on the TV shows, they they make it seem like problems are solved super quickly. Or you go through this whole diagnosis pattern and it turns out that actually it was one thing causing the problem, and once that one thing is fixed, everything is resolved and now your life is back to being perfect. Well, that's not really the reality of how things typically work. A lot of times what happens is it takes the physical exam first, it takes getting information from you, it takes doing testing, it takes doing a lot of these things to get to the root cause of what's going on with you. And there, a lot of times, that root cause is not just one problem. Actually, it could be more than one issue working in conjunction to cause the symptoms that you're having. So be patient with your medical team. I know that we want answers right away because we're in an era of give me answers now, give me whatever I want now. But some things, yes, you can get answers right away, but there are things that does require time, and it does require diagnostic testing and interpretation of that testing and trial of treatment. And the same treatment doesn't always work for everyone. Sometimes it takes, one thing will work really well for this group of patients, but it may not work the same for the next. Whereas there's other treatments that are tested and FDA approved for everyone. So just be patient with the diagnostic and treatment process, and don't get carried away with watching what you see on TV shows with the quick response. Okay, so that was what we talked about in the first week, and I'm gonna just check if we started having any questions. So I just wanted to say welcome again to everyone who's joining us. I'm so happy to have you. I'm Dr. Thorpe Mize, and again, it's my pleasure to go through these discussions with you all and see what questions you all have and try to answer your questions. And if I don't know the answer, I'll get the answer for you and we'll talk about it the next time. Okay. So far, I see here that one commenter said, the health shows and TV shows is so true. Most people do not read the disclaimer saying they are not liable for the use of their information. And that is absolutely true. Even if they don't say it up front, usually it's at the end of the show. So if you're really paying attention, they will tell you that if you have a medical issue, even if it's something that was similar to what was portrayed on TV, they tell you go see your doctor, because you cannot go based off of what they're portraying in the show. They tend to be fictionalized characters, and even if it's something that's snatched from the headlines, there is some truth to it, but then they also have to create something that's going to be interesting for the audience to watch. So we got to remember that. Okay. And so that's about the TV shows. I'm going to keep going on and we'll double back if there are any additional questions about that. Okay. So the next thing that we talked about combating misinformation. Then we talked about ways to build a doctor patient relationship by making sure that you're telling your doctor the supplements and herbs you're taking. Now, I know that a lot of us like to take, especially when we're from other countries, or even if you're here and some people are consider themselves health gurus or health nuts, and there are all these different herbs that have known beneficial effects because they've been used for thousands of years, whether it be Chinese medicine or, you know, and so people take all these different herbs in order to help boost the immune system or help to decrease inflammation. And while those things are fine, the key here is letting your doctor know that you are actually taking those things. And the reason for that is, like I mentioned before, if you are taking a herb or a supplement, we want to know so that we know if it's going to interact with any of the medications that you're taking. Now, I will say this, a lot of herbs and supplements that are on the market, they're not regulated by the FDA. So someone can say this and this and this is what is in this supplement, or but you don't actually know what is in there. That's one part of this. Then with the herbs, there is an understanding of how some herbs work, but there is not a full understanding of all the various herbs that are out there. And so, even though I'm telling you, tell your doctor what herbs and supplements you're taking, there are many of them that we won't actually know what the interaction is with your medicine until you do take them. But the ones that are more common and we do have information about, we like to know, because we don't want you to take it with a medicine that we're going to take if it's going to either inhibit or make that medicine less effective, or in some cases it it creates a buildup of that medication in your body. So in essence, instead of the medicine moving through your body at a rate that we expect, it'll move through your body slower, and so potential side effects from that medicine can happen more frequently if that happens. So it's really for your health that we're saying, tell us what you're taking and know what you're taking. Because some of us, we take these herbs and we take supplements and we don't actually know what's in it. What I'm trying to tell you all is be informed, stay informed, and do what is best for you. But communication and having these conversations with your doctor is always going to be helpful. Okay? It's always going to be helpful. And another thing that I just wanted to mention as far as herbs and medication taken is concerned, some people will be like, I don't like taking medicine. I don't like taking medicine, but they are quick to take a supplement and quick to take a herb, right? Most of these medicines, I will tell you, even though they are manufactured in a laboratory, the initial primary ingredient was found through the evaluation of herbs, right? And so I do want to encourage you that these medicines have been tested, and so the difference between you taking a herb that's what most people would like to say is natural, and then taking a medicine that is a pill that is prescribed, usually the major difference is one has been tested in a laboratory setting with a large patient population or a large group of patients, and we have documented what the potential side effects are, and documented the different things that can happen with it, and documented the mechanism of action and how it works. And with a herb, oftentimes we don't know those things. We don't know what the side effects can potentially be depending on how much of it you're using or taking. We don't know how it's gonna, some of them, how they interact with other medications. And sometimes we don't know what the side effects are. So some herbs you can take and okay, this herb is great because it's going to have anti-inflammatory properties, and I need that. But that herb can also have another mechanism of action that's doing something else in your body and you don't know about it. So again, I'm encouraging you just to have the conversation with your doctor so that they know what you are taking. If it doesn't interact with anything that else that you're taking, then great. If you're taking these medicines and you end up not needing to take any prescription medicines, great. But again, being informed, communicating, those things are the key. So any questions regarding that? I am going to continue to check my social media platforms. You can send me messages or comments on this live session, or you can send me comments or messages via uh, any of the social media platforms under Mize Health. That's on Facebook, Twitter, Instagram. We are here for it all. Okay? Send in your questions and let me know. And if you are not able to ask me questions via any of those sources and you know me personally, just text me your question because I'll be checking to make sure that I answer you guys. Okay? All right. So I'm going to just keep going. And so another comment was, no two people are alike. Absolutely true. So even, one of the things that sometimes people complain a lot about is that, oh, my doctor just treats me like everybody else. And the truth is, no, none of us are alike. We're all unique, we're all different. And so part of having these necessary conversations, and part of telling your doctor your medical history, part of telling your doctor the medicines you're taking and the herbs and supplements you're taking, is because what you're doing and what you're taking is different from the next person. And I'll be honest, even if it's the same as your cousin, friend, mother, whomever, it may interact with you differently, right? So it's important for you all to be mindful of that and just communicate. And the at the end of the day, what this commenter said, which is, this is why doctors help. We want to make sure we know this information so that doctors can prescribe the right medications for you. And that is absolutely true. We want to prescribe the right medications for your condition and for you. So we're going to continue to move on. The third week of building the doctor patient relationship, I talked about uh, the importance of being consistent. And this one was really, when I said consistency meant in terms of what you are telling us. Because sometimes, I'll be honest, you all come in and you tell the nurse one thing, you tell the doctor something different, and the story just keeps changing. And we are like, we're basically just hunting for the truth. We want to know the truth. Don't be embarrassed to tell us the truth. Because sometimes, I'll give you an example. A lot of times I have patients who will say, oh, I'm coming in for, I don't know, just, you could pick anything. I'm coming in for a rash on my arm. And they come in after the nurse does their thing or the medical assistant does their thing, and they come in the back, and now they're talking to the doctor, and it's like, oh, actually, I was having vaginal discharge. That's very different, right? So it's, don't be embarrassed to say that that's what the issue is up front. We are medical professionals. Our goal is to get what the issue is, or what is bothering you, what is your concern, so that we can appropriately address that. Sometimes when you tell us one thing and it turns out to be something else, we were prepared to address a certain thing, or if it is a procedure or something like that that's necessary, we're prepared for that. And then when you find out it's something else, now we have to completely switch gears and prepare for something else. And Don't get me wrong, myself and my colleagues do it all the time, and we just do whatever we need to do to take care of you. But in terms of making the interaction go smoother, easier, to continue, like I said, to build that doctor patient relationship, being consistent in your story, in what you're telling us, absolutely is important. So when you come in, have your story together. Sometimes, you tell the nurse one thing and it takes some time before the doctor comes in and you remember additional information, and that's all that it is. You just want to tell us more information. That's fine. I also do I do tend to ask my patients once they come back, I do ask again, tell me about what brought you in. And the reason is because I need to hear it for myself. Because sometimes the story just changes. The story just changes. And I do need to hear your account as the patient. I need to hear your account of what happens. And a lot of times, in the process of you telling me your account of what happens, I do hear more information that is pertinent to um, what may be going on, and to potentially to how we will treat you. So just make sure that you are bearing with us when we go over all the details of everything. And it sounds like it's redundant, or you're like, oh, I just got asked this, just before. Didn't the nurse tell you? It's not that the nurse didn't tell us, but what they can tell us is usually an abbreviated version, and really we need to hear the whole story from you. Okay, so that's what we talked about. So all of these things, basically combating misinformation, by listening to your doctor, bringing your concerns to your doctor, and telling your doctor what herbs and supplements you're taking, being consistent, telling us your story so that we can address the things that are ailing you. Those are all ways that we can build a doctor patient relationship. And I do think that this is something that is so important and so critical right now, because a lot of us feel so disconnected from our doctor. It isn't the relationship that it once was. For those of you who are a little bit older or of a certain age, remember having really great relationships with your family doctors or with your primary care doctors. You remember that. And I want us to get back to a place where we are having a good enough relationship with each other that you are trusting your doctor when they make a medical decision for you based on their training, knowledge, and expertise. So you're trusting your doctor by telling your doctor the truth about what's going on. And you know the result of that is that we're taking better care of you. Our goals in primary care, our goal usually is to prevent you from getting sick to the point of needing to be in the hospital. We prefer that you come into the office than we're seeing you in the hospital. And so at the end of the day, that's what we're striving for, to keep you healthy. And so the things that we can do to ensure that you remain in good health, that's what we're going to try to do. But it's hard to do that if we're not getting the full story or the full picture. It's hard to do that if you're leaving bits of information out, like the things that you're taking. And it's hard to do that when your primary source of advice is someone, um, not unlike myself, but someone else on the internet that may be giving you information that is incorrect. So please check your sources, verify that these people that you're getting information from actually have the expertise to advise you. And when I say not unlike myself, so I tell you all, I'm Dr. Thorpe Mize. If you are concerned that, okay, is she a real doctor? Guess what? You can look that up. It's not hard. Just like you Googling things that may be wrong with you, you can Google the doctor that you're talking to. You can check the sources. The people When people come online and they're saying, I'm Dr. So and so, or I'm this person, go on ahead and check. Because if you go online to check to see, is this person really Dr. So and so as they say, you will find out. Check your sources. make sure that you're getting information from reputable sources. I cannot stress that enough. So I'm going to go ahead and start checking um, for questions and seeing what questions you all have on all the different platforms. And feel free to ask any questions that you have. Again, this month, it's been all about building the doctor patient relationship. I'm so excited that we get to talk about these things because it's important. We're in a time where relationships are important. We don't have it as much anymore because social media, because of the way that we relate to each other, is just not the same. And I do want us to get a piece of that back where you can talk to your doctor and trust your doctor. So the next comment says, this is where doctors training and skills come in. They can pick up on things that others might miss. Sometimes information is lost in documentation, and that is absolutely true. Absolutely true. That, sometimes what happens is, you know, when we ask you, for instance, you were in the hospital, you got discharged from the hospital, and as a primary care doctor, I would absolutely try to get your records from the hospital. And the information in those records usually tell me what your labs look like, what imaging you had done, what the plan was, or hopefully tells me what the plan was when you were discharged and what you should be doing. And so, what happens sometimes though is we still don't have the full picture. And so, when you come in after being discharged from the hospital and I say, hey, patient Y, can you tell me what happened, and what is your understanding of what happened while you were in the hospital? Because your account of what happened may be very different from what I'm reading on the paper, because what I'm getting on your discharge summary, like I said, is just the facts, the details, the test results of what happened. But your account of what happened tells me what you went through, what you're expecting the next steps to be, what your understanding of the process was. And I think those things really are important for you as you're continuing to heal. So that's just one example of where maybe I do have documentation, but that documentation without your story is just not enough. And I do want you to tell me what it is that happened. I think those are critical things, right? So thank you for those comments. And for anyone that has questions, feel free to send your questions in. I'm going to go ahead and check some of our social media platforms to see if anyone has posted anything thus far. I'm so happy to have you guys on here with me tonight as we talk about building the doctor patient relationship. If you all have any topics that you want to see discussed, you can also place those in the comments. If you want to book me for a speaking engagement, you can send me a direct message or send a message in the comments. I'm happy to review those and have discussions with you about those. So, as we continue to move forward, let's see if there are any questions that have come up. And I do want to say also that, again, the tips that I give here are really to ensure that you remain in your best health. And if you're not in your best health, we want to help you to get there. And we want to take the right steps to get there. Oftentimes, especially as people of color, we mistrust the health system and mistrust the doctors that are there to treat us. And, while I understand where a lot of that comes from, I do also want to say that so many of us are here really to hear, to listen, and to assist you in the best way that we can. And I do know that it is important for us as physicians or clinicians of color to have a face, and so that, you know, you all know that there are people that you can go to that do care about your health, that will spend the time that you need to address your concerns. We're here. I do think that sometimes the expectation from the patient's perspective may not be as realistic, you know, and I think part of giving you all information or trying to educate you all about the healthcare process is so that we do come in with realistic expectations. We do come in knowing what boundaries exist. And so, again, as you all have questions, feel free to ask. That's what I'm here for. Okay? All right, let's see. Is there any way to get an idea of ingredients in a supplement or health drink? Yes, usually it's listed on the bottle. However, again, because these things are not regulated by the FDA, they are not mandated to put every ingredient on that bottle. So while a lot of them will say, oh, this is what's here, they'll only give some of the information about what's there. They don't always put all of it. And sometimes, um, because some of the mixtures that goes into certain supplements or certain health drinks may be patented or proprietary, some of them will not list it at all. And so you may actually not know. So is there a way to get an idea? It's based on what is placed there already. Are you able to get further information about what's in the supplement? You can always reach out to the manufacturer, but it's not a guarantee that you will get that information. And then, can we submit to a board or body for investigation? So that's actually a great question that I don't have the answer to, but that's something that I can find out for you. And so this is one of those situations where, like I said, if I don't know something, I'll tell you I don't know it now, but I will investigate for you. Okay. So, is there a way to submit to a board or body for investigation? You likely can do it to the FDA, but I am not I'm not 100% sure on that. So actually, I will have to find that out for you. But yes, be careful about the ingredients and supplements. If you sometimes doing individual supplements, like for instance, if you take a B supplement or B complex, then taking a B complex that's just the B complex is fine, versus like if you take a concoction of different things, because usually those concoctions have things in it that you may not be aware is there. But on most supplements, they do try to list out all the ingredients. It's just that you may not understand what all of that represents or what all of those are. Okay? So that's basically what that is. Would do the right thing or do well to read the ingredients on the supplements that you take. Okay, that was a great question. I hope I answered that question for you. Any additional questions? Okay, so thank you guys once again for joining me. And I'm so thankful that you guys have been participating and oftentimes asking questions. Like I said, if you have to submit me any questions and you're unable to do this on YouTube Live, feel free to do it on any other of the Amize Health social media platforms, and I'll be happy to answer it there. Okay. So, you know, I I want to put this slight tidbit in there. And it may sound a little harsh, but sometimes we need a little bit of tough love. And you know, what it is that I don't want you guys to be out here diagnosing and treating yourself, because if you're going to do that, then what need is there for you to come into the doctor's office, right? So, no need for you to diagnose and treat yourself. That's what we're here for. I understand that the wait times to get in to see your primary care doctor may be very long. And so sometimes, we sit at home with issues for longer than is necessary because you feel like, oh, I can't see my primary care doctor. But I will tell you, you can utilize telehealth or telemedicine. If you can get a telemedicine appointment, one of the best ways to utilize that particular resource is by scheduling an appointment and finding out whether or not whatever the issue is that's going on with you can be addressed via telemedicine versus having to present in person to get it addressed. If it's something that you absolutely know that you need to go in for, like, oh my God, Timmy fell down and broke his leg, that's not a telemedicine issue. That's a, you need to go into the doctor and get seen. Okay. So for those type of situations, go in and get seen. I wouldn't wait on a primary care doctor's appointment. I would go to a basically urgent care or an emergency room for something like that. But again, if you're unsure about what to do and you're like, oh, I have this problem, my doctor, doesn't have any appointments for weeks, and I really need to get seen, utilize telemedicine for that. That's actually one of the best ways to utilize telemedicine. Okay. So please, please, please don't sit at home when something is wrong. You have an inkling something is wrong. You're not sure what it is, but you sit and let it get worse. Please don't do that. Go ahead and get evaluated. Okay. So, as we continue to talk about building doctor patient relationships, uh, these tidbits that we've talked about, combating misinformation, by finding reputable sources, credentialed, credible, knowledgeable people to get information from, trusting your doctor, going ahead and informing your doctor of all the medicines, the herbs, and supplements you may be taking, and being consistent, telling your doctor about what it is that's wrong, showing up for your appointment on time. All of these kind of things goes a long way into building the doctor patient relationship. So if you all don't have a lot more questions or any more questions, I'm going to cut tonight short, but I do want to say this coming month, we're going to be wrapping up these series on the doctor patient relationship by doing maintaining the doctor patient relationship. So, just like any other relationship that you have, right? There's always a start and then you're building it, but then you get to a place where you're kind of sitting in that relationship and you need to maintain it. You don't want it to go bad or go sour. And so this coming month, the month of October, we are talking about maintaining the doctor patient relationship. And I think that that should be a good series also, because at this juncture, the doctor patient relationship, I think, is one of the things that we don't address enough. And I think that even though I'm talking to you guys as patients, I am a patient too. So I am also talking from the perspective of someone who wants to go in and have a relationship with their doctor. So that, and the fact is, as clinicians or physicians, we also have a role in the relationship. Relationships are not one-sided, right? Then you're not in a relationship, right? Relationships goes in both directions. So each party has a role to play. And I think that it is important for each of us to play our part. And I do want you all, and I'm going to mention it about maintaining the doctor patient relationship also, but I want you all to recognize that doctors are not martyrs. We're people. We have lives, believe it or not. We have lives. We have things that we need to do that are outside of medicine. So the expectation that we are available for you 24/7 is not a realistic one. So, and again, this plays into the relationship, right? You can't expect someone, there's certain boundaries in a relationship. You can't expect people in this kind of professional setting to be available 24/7 and then get upset if they're not. Build a good relationship with your doctor. You will have a responsive doctor to when you do have issues, because why? I care about you. So I'm going to care about the issues that you're concerned about, and I'm going to try to address it. But there are times that we need downtime. We need to sleep. We need to eat. We need to go to the restroom just like everybody else. So please be respectful of that, okay? I am so thankful for you guys for listening. And again, please drop comments. Let me know what you thought about this building a doctor patient relationship series. And next month, like I said, we'll be talking about maintaining the doctor patient relationship. Be sure to follow me on all social media platforms at Amize Health. And please continue to listen, like, and more than anything else, share as you continue your journey to amazing health. Thank you guys and have a good night.